It's fantastic that you're able to join us for this Africa Dialogues webinar today on what I think is such an important, salient, and critical conversation that is happening in almost every single country in the world, not just on the continent, which is how do we reopen our economies safely? How do we balance lives and livelihoods?
I've been looking forward to this. Really powerful panel here. We have Miriam Altman, Southern Africa. We have Humphrey Karamagi and Kipruto from WHO. And of course, we have Cabinet Minister in Rwanda, Clare Akamanzi. And thank you all for joining us. And Edwin has tried to phrase the conversation. And many of us, actually, anytime we talk to people, they're asking, when are we opening? Today I was in a board meeting, and one of the board members said, we are likely not to open in Kenya until end of July. This is the question in everyone's mind. Open or close? But as we keep saying, it's not a switch, it's not on, off. We see it more like a dial of balancing, where you may think, what you may call balancing economic needs and health or public health considerations.
When we look at the trends of the disease in Rwanda, we've seen that most of our cases have been directly linked to border issues or border imported cases. And if you look at the 90% of the growth of the diseases over the last few weeks, it's really been truck drivers along the borders, it's movement of populations around the border. And so we've understood that we have to really take care of those clusters where we see them and try to, partially lock down those clusters while at the same time allowing the rest of the economy to grow.
We've got to be thinking about what's going to be happening to commodity demand, to oil demand. So sources of foreign exchange it's a huge question. We're going to have to think about what's happening between China and the U.S. and how to chart that so we don't fall, we don't end up getting shot in the middle.
What's quite exciting about the response in Africa is that it seems to be driven by Africans. So you find each country sitting and trying to work out what it needs to do, not just following a script from somewhere else. And I think that's quite an important progress that we're seeing in many of the countries, really solving the problems which they are facing, which their communities are facing. You might say whatever you want about Tanzania versus South Africa, locking down, not locking down, and so on. These are decisions which are made at the country level. Yeah. And the country sits and says, based on the way we look at things, this is where we are balancing our risk, and so on.
From the modeling for over a period of a year, we realized that there will be the slow rate of infection in many of the African countries. So meaning that the lower transmission and deaths compared to previous estimates, as Humphrey has mentioned, which has been reported from other modeling. So the most important thing for us to realize is that this particular disease might be with us for a long time.
How do we continue providing health services even with COVID? Because I think that is a critical shift that we need to make. And so stay tuned.